Hi, ma'am. Hello, ma'am.
Hello, you can hear me now?
Yes, ma'am. You're audible, ma'am. Vasanti.
Now you are not audible actually.
Hello, Dr. Anjali.
Hello, Vasanti.
Good to see you.
Ma'am, just to introduce to you Vasanti. Vasanti is our regular anchor for all our webinars across India and international. We do international training programs for doctors, teachers, nurses, and she is full-time Manipal Hospital, I can say, anchor, both for hosting the shows, for hospital new launch, new campaigns, any wellness initiative. And also, Vasanti, I want to introduce Nirmal Vadan, ma'am. She is from the principal of Kalyani School. Ma'am, just want to introduce to you about Vasanti. Vasanti is ex-NDTV correspondent, and she has worked in all international forums and all. And we normally use this type of anchors for hosting our show. Vasanti, it's all yours.
Yes, we have about 4 minutes more. I'm also looking forward to starting the program. But it's really wonderful. Yes, as Arun mentioned, I'm a journalist and I'm also the founder of Pickle Jar. We tell stories through podcasts and we are helping Manipal do all their storytelling as well. It's wonderful to meet everybody here.
Nice meeting you, Vasanti.
Thank you. As soon as I think we get the, about 4 o'clock, I think on the dot, we should be able to start this.
Yeah.
I can see people are putting their introductions. Very good. Please keep that coming.
Vasanti,
Yes.
when you, I think you're going to say that welcome, the first sentence you're going to say, no? Then you're going to give me the mic for a few minutes, right?
That's right.
Yes, for you, ma'am. Yes, for you.
Yeah. So we will have, a customary anapan and then I'll give it back to you.
So, sorry, customary?
Anapan, 2 minutes of a meditation kind of thing.
Yes.
Ma'am, after that, you will also address the gathering, no, ma'am, that we decided, no?
Same thing. I will
sure,
talk, I will address, and then we will stop for 2 minutes. I'll give you all the instructions what to do.
Yeah, sure.
Please sit straight, and those with specs, take them out, etc. All those things.
Sure.
And Arun sir.
Yeah, ma'am.
I'll be doing the vote of thanks from the
side. Yes, ma'am. I put in the group in chat this one also in the chat flow plan, entire flow plan.
Thank you.
Yeah. Vasanti, just to introduce to you our hospital directors. One is Dr. Viju Rajan. Hi, ma'am. Good afternoon.
Hello, Dr. Viju.
Hi, good afternoon.
Ma'am, Vasanti is our regular host at all Manipal Hospitals event. And also introducing to you Lakshman sir. Lakshman sir.
Hi, Arun. Good afternoon.
Sir, we have.
Vasanti, good afternoon.
Hello,
okay.
Lakshman.
I hope you can recall me, Vasanti. We met in Salem.
Oh, yes.
Yeah.
Yes, of course. Wonderful to see you again.
Yes.
Vasanti, just 2 minutes. Dr. Viju and Lakshman sir, main two people I want to introduce. One is Madam Anjali Gurujar. Ma'am. And Nirmal Vada. Yeah, ma'am.
I was just taking a sip of water. Hello.
Yeah, ma'am. Last time you had met with you, ma'am, also.
Yes,
Nirmal, ma'am. So she is here. So everyone is aware of flow plan and all. Sharp 4 o'clock, Vasanti will host the show. And it is already live on YouTube, and we have nearly 200 teachers, real heroes already on the stream, actually live stream.
Yeah.
I'll put in my school group also. Let them join again in case they need a reminder.
Sure, ma'am. No problem.
Nirmal ma'am, thanks for putting it up on the main Sahoday group.
I know, but I see the attendance is so poor.
No, they'll join in actually. By 10 past 4, many more will join. Because I checked with Arun yesterday, he said 2,000. And many will join on the YouTube.
So 2,000 have registered. That's fabulous. That's nice. So we've achieved something.
Yeah, and they will join on the YouTube, many of them. They will log in on the YouTube.
Shall we start? It's 4 o'clock.
Yes.
Yes, ma'am. Please start.
Yes. Yeah.
So it is that when it strikes 4 o'clock, it's time for all of us to come together into the classroom. Except that this is a classroom full of teachers, educators who already are doing a fantastic job in imparting learning. And I have the privilege of speaking to a community of you, about your wellness, as part of the Manipal Hospital's program and webinar today. So as we say in this part of India, namaskara to everybody, namaste, adab, and a good evening. My name is Vasanthi Hariprakash. I am a television and radio journalist. I'm also the founder, editor of Pickle Jar, and we tell stories. We help brands tell stories through fresh forms of content. Manipal Hospital is one such entity, always doing something so new and so impactful. I would like to spend the next couple of minutes before I start inviting speakers. For those of you who have joined us, and I can see the numbers are slowly growing on the right side of my laptop. So I totally encourage you to use the chat box to tell us who you are. What's your name? Which school? Which institution you're joining us from? What are what do you do? And what would you love to do? And please keep using this chat box. Let us put this 1 hour or so to the best use. I think we are getting technology is making it possible for us to join from different parts of the country and beyond. So please use the chat box, call me Vasanthi, and of course, continue to engage. Now, Manipal Hospitals, ladies and gentlemen, has been the front runner in creating public awareness campaigns for the welfare and benefit of people, not just in India, but across the globe. You could say I have been eyewitness. I have also been a part of this. So the endeavor is always to change mindsets, encourage the public, how you can adopt a healthy lifestyle. And this at an early stage of your life, because it's all easy to sort of go wrong at the beginning and then try to course correct. Instead of that, is it possible to have a change towards adopting a healthy lifestyle? And this will have a lifelong impact. Now, with the same ethos, today, Manipal has organized a school wellness initiative for teachers in Pune. So all of you who are joining in are from the Pune region. There are those of you who are from Pune, probably are at the moment in different places, but yes, Swagat, Sabika. So this healthy nation, as we always say, is possible with the aim of creating healthy students, and you are the ones with that powerful tool. Already, we've had an opportunity to interact with nurses and doctors and army people and media people. And now when we are speaking to you, our request to you is also that please become a more active part of this. Manipal Hospital is a part of Manipal Education and Medical Group, that is MEMG. It's one of India's leading medical research, education, and healthcare service providers. It manages hospitals, educational institutions, insurance agencies, and medical research facilities. I, of course, have more statistics, and as friends from the teaching fraternity join us, we will share more. But today's doctors on the panel, and I wish to introduce, before I hand the stage over to Madam Anjali Gurjar, we have the consultant cardiologist, Dr. Dhananjay Zutshi, consultant orthopedic, Dr. Sinu Kumar Bhaskaran, Dr. Asmita Dongre, consultant OBG, consultant Dr. Kavita Verma, consultant neurology, Dr. Bhushan Joshi from places like Baner and Kharadi. So before we move ahead, for the welcome address, please join me in welcoming Madam Anjali Gurjar, Principal of Pawar Public School, Nanded, Pune. Namaskar, Madam Anjali.
Namaskar, Vasanthi, and thank you. Good evening and namaste, everybody. A warm welcome to all of you from Pune Sahodai member schools and also to the elite staff from Manipal Hospital Group. We are privileged to get an opportunity to hear from the esteemed doctors. You are the best persons, dear doctors, to understand that the educator's health is of utmost importance. All of us teachers, being nation builders, We have to be physically and mentally healthy and happy to deliver to the children. The teaching profession comes in with professional health hazards. Lack of time, pollution, etc. are also the factors. For the information of all you doctors on the panel, the Sahoday is a group of CBSE affiliated school principals working together. Saha and Uday, all of us helping each other to sort out our issues and to give value-added inputs in the form of training, seminars, competitions, etc. I welcome everyone once again, and I thank Nirmal ma'am, principal of the Kalyani School, for introducing us to Manipal Hospitals, and to Mr. Arun, the coordinator from Manipal Health. Let us begin with our customary Anapan so that we are all focused for the talk. I will give you a set of instructions. Please follow those. It will just take a minute or two. I request all of you to please sit straight. Those with spectacles, please take them out and keep them in a safe place. Close your eyes, feet on the ground, both palms overlapping and placed on your lap. Think of what you're going to hear for the next 2 hours about your health, where we all need to improve. Let the other thoughts rush in. You cannot prevent them unless you are a practitioner. Be in this state for a minute. Let us all say a prayer. O God, help us to gather as much information as possible from today's seminar. Help us to focus and be present mentally and physically in today's seminar. Thank you for giving us various opportunities for self-development and self-improvement. I request everybody, please rub your palms and place them on your eyes very gently. When you feel comfortable, open your eyes with a few blinks. Thank you. Manipal Health, Vasanti, please take over.
Such a beautiful practice. You know, Dr. Anjali, I was just thinking to myself, why don't we do this to all other things as well? Thank you for giving us this very powerful intent. You know, जैसे कहते हैं संकल्प लेना या संकल्प करना. So I think that to create a sense of focus on what this program is going to be is definitely going to help our community of people who are listening in to us, who have joined us. Thank you once again. Now, to speak about Manipal and the importance of wellness in school, may I invite Dr. Viju Rajan, Hospital Director, Manipal Hospital, Paneer. Over to you, Dr. Viju.
Yes. Very good evening, and it's wonderful, wonderful actually to see so many people logged in. Thank you, Vasanti and Dr. Anjali. I think it's an amazing initiative, and very honestly, school health is always associated with students. But I think we've turned this around on its head, and we've completely understood that unless and until the school students themselves and their educators are going to be healthy, mindful, exactly like what Dr. Anjali told us, be present now. If we have those kind of anchoring into the world, the students definitely are going to be much, much benefited. I think COVID has completely changed the health landscape, the school landscape as well. And we cannot forget, and the contribution of the teachers, me, myself, being a mother of a 11th and 12th standard student who went through those 2 very, very formative years. I mean, I think every year is formative, but I would say, landmarking in the sense, completely different, isolated, but in a way, all the teachers, I think, were the backbone of having these students come across through these COVID schoolscape, and have come out and emerged very strong with different issues we understand, and we're all struggling with those kind of issues. And I think unless teachers, educators, school administrators, and I think it's a wonderful fact that we have so many people logged in, that unless they themselves realize the importance of the anchorage that they provide to students, and ensure that the team that is actually geared towards providing a safe school atmosphere starts with y'all. So it's very, very, I would not say innovative, but I think we're kind of late in actually having to get this to this level to ensure that teachers, administrators, and all of you educators out there, it's become so highly competitive. Everyone's multitasking with all these video Zoom calls and everything. Like Dr. Anjali showed us the way, we really need to be mindful, be present now. These kind of things will go a long way. The consultants that we have actually here to speak for you and to kind of address all your concerns are things that I think we have not been taken too seriously. We haven't been having the time or the energy to focus towards taking care of our health. And we struggle, all of us, like that, with busy schedules, with pressures of school and exams. I think the school education system and the team that has come together to lead all the teachers is doing a wonderful job. And it's just, you can assess a pulse of the requirement or the need of this by the number of people who have logged in. And my only request is, please do take this not just as something that you need to attend or to participate in, but something that you will go back and ensure that you yourself take time out for doing basic health checkups that are required. It's not just a physical health checkup, it's mental well-being, it's peace, and it's also about being holistically satisfied with what you're doing to prevent burnout. I think teacher burnout and burnout in most sections of any profession is very common. So it's essential that we take this seriously, and we are only going to give you small pointers. But I think if we have leadership of this at the school level, like we're seeing now, if y'all can ensure that a survey is done, that people really make sure that they participate in taking care of their health in a very focused manner all through the year, that will be very essential. So that's all I have to say. Thank you very much for coming together. I think this is beyond your working hours. This is something that maybe should be incorporated into your school working hours, so that it becomes becomes part of your routine and lifestyle. So thank you all for participating. Please do give us feedback. Manipal Hospitals in Pune is now at Baner, as well as I have my colleague Lakshmanan on the east side of Pune in Kharadi, and we're in Baner in the west side. So we've got you covered. So across Pune, if there's anything that you require, we are all there. But I think the essence of today's this thing is preventive health. So I'm sure all of us would take the necessary steps in that direction. Thank you.
Thank you, Dr. Viju. So succinctly, you have, you put the importance and relevance of what the program is, given us the big picture. I would like to also acknowledge those who have introduced themselves. Priya Gaikwad from Sri Sri Ravi Shankar Vidya Mandir, Pune. There is Latika Kulkarni. There's Savita Pawar, who has wished us. There's Ganesh Kumble from Sri, Heritage International School, Kasar Amboli, Pune, and other people. So yes, the chat box that you see at the bottom of the screen is where you can leave your name and which school you're from. You can also use it to ask questions as our speakers come in one after the other. May I now invite the consultant orthopedics, Dr. Sinu Kumar Bhaskaran from Manipal Hospitals, Kharadi, to please present. Dr. Sinu Kumar, yes.
Hi, good evening. Am I audible now?
You are. You are.
Okay. And at the outset, thank you so much, for having us. I think Dr. Viju had just put it across quite clearly that I'm though an orthopedic surgeon and surgery being my, main profession. Today I'll be talking about ways how we can avoid coming to a surgeon. So we'll be focusing more on the preventive aspect of orthopedic and musculoskeletal issues rather than looking at what surgical treatments are needed once once you develop kind of end stage musculoskeletal kind of diseases. So again, once again, thank you so much for having us. And like Dr. Anjali mentioned earlier, so having a audience of teachers is both a bit unnerving, and at the same time, it's a big honor and privilege as well for us, to get to address you all. And I hope on behalf of Manipal Hospital, we'll be able to, clear most of the doubts that you have. And at the same time, like Dr. Viju mentioned, we have you covered. Any kind of issues at any point, you can get back to us. Even today, you can use the chat box as an OPD consultation and just fire away all your questions, and we are here to sort them out. So today, I'll just share my screen. And so is my screen visible? Share.
No.
Not yet, doctor.
Yeah, sorry. Yeah.
Yes, now we can see it.
इसमें देख सकते हैं full slide में. Okay. ठीक. So like I mentioned before, I'm Dr. Sinukumar Bhaskaran, and I'm an orthopedic consultant at Manipal, Karadi. My main areas of interest being joint replacement and orthopedics. But today I would be focusing more on the general orthopedic kind of OPD that we run, and what are the common issues that we see in our day-to-day outpatient practice. And so most of these are, lifestyle related and actually related to our daily postures, our daily activities that we do. They begin off as small kind of irritations, and then later on they become major pathologies, and which then would need kind of large scale investigations and treatment. So we'll be looking at how we can avoid them. To start off with, I'll just run through the common kind of situations that or issues that I see in my OPD routinely. I think the most commonest thing that patients come to us with is, neck pain or the cervical strain, what is called as, usually ligament-related problems in the upper back or the neck region. Then we have the very common kind of lower back pains, what we call as a lumbar disc or lower back strain kind of issues. Then we have this very new kind of problem that we have seen in the last few years. That is, it's this guilt consciousness of, our kind of lifestyle where we spend the entire week, sitting at one place and not being very active. And then we try to overcompensate towards the weekend by, trying and being active, playing a sport. And then we end up with certain kind of injuries. And that's pretty common as well. And so what we do and how we deal with them is something that I'll be talking about. And then, of course, the commonest injuries like overuse injuries because of the kind of devices that we are using nowadays, inflammation around your thumb, I'll be going into details of that, the carpal tunnel syndrome. These are just problems that can be very easily managed, not something that needs major kind of treatments, but just to make you aware of that, these kind of conditions exist and how we could, prevent them rather than, looking at treatment of these. I think the biggest change that has happened is our work profile, the way we actually have to, the work profile in the last 20 to 30 years is the kind of work an average person has been doing, from the kind of physical kind of activity that he was doing to, as you can see in this picture, it's now mainly sedentary. We are sitting at one place. We are, sitting in a particular posture, either using a laptop or maybe a phone. And so that's had its own advantages. Like, when you avoid heavy physical work, when you're not lifting things, there are certain advantages of that. You have prevented other injuries, but at the same time, then we've commonly seen other kind of issues have cropped up. And one of the most commonest thing, like I said, problem that the patients come up to us is with a neck pain or stiffness in the neck. So something called as a cervical sprain. It's basically the ligaments that hold your neck, the skull to your body, being put under a lot of strain. And then because of this happening over and repeatedly, these ligaments undergo inflammation, and this inflammatory pain then leads to a lot of kind of spasm around your upper back muscles, and then patients usually present to us with a lot of stiffness around the neck. So this is something called as a cervical strain. And why this happens is something I'll just try and explain to you. So if you can look in this figure here, so when you're sitting upright and looking straight, you can see the amount of, that is the weight of the normal skull when you're sitting straight and looking at an object right ahead of you. But the moment you start bending, the same skull, which was about 10 to 12 pounds, it increases to almost, 5 to 6 times of the weight. So if you can see, something was about 10 to 12 pounds, it's almost 60 pounds when you're bending at 60 degrees or 45 degrees. So if you look at the kind of activities with phone that we normally use it now, earlier we used to use phones just for speaking, but nowadays the usage of phone is more for reading, maybe even texting, reading, and those kind of things. And we tend to forget the amount of time we are spending in these very abnormal or unnatural kind of position. So if you can see the last extreme right hand in the image, so that is the most common kind of, I think, posture that we adapt when we are actually really into something, we are reading something and spending a lot of time. So you can see the weight of the skull, which was around 10 to 12 pounds, has now become around 60 pounds. So the same muscle, which was actually designed by nature to just take this particular amount of weight, now has to take multiple times that same kind of weight. So that is the exact reason why these ligaments, which earlier we never had these problems, and that's the reason why these ligaments have started undergoing this kind of chronic inflammations, and then slowly starting off as pain, spasm. And in the initial stages, it's just that mild irritating pain or stiffness that you get once in a while. And these are usually easily treatable with just medications and some physiotherapy. But then if you continue these kind of wrong postures for a long time, what happens is, I don't know if you could appreciate on the image on the right hand side. So if you look at your spine, it is not just a single piece of bone. So there are multiple bones that are stacked on top of each other, right from the base of your skull till the tip of your spine at the bottom. There are this multiple bones which are stacked on top and stacked on top of each other. And in between them, there is a small cushioning material called as a disc, which acts like a shock absorber. And now when you have these strains coming on your cervical spine, or even the lumbar spine for that matter, for very long hours, what happens is this disc tends to migrate or move from its place, and it moves behind and it starts pressing onto your spinal cord and your knob. Now, this is a serious issue. Now, here what you develop is not just neck pain. You would also complain of some pain in the shoulder, or you might complain of some pain in the arm as well. This is something what is described as a radiculopathy or a neuropathic kind of pain. Now we have progressed from a situation which was earlier just easily treatable with a few medications and physiotherapy, maybe rest, but now it is something where you might be looking at kind of an intervention like a surgery or maybe a small injection there. So it is the same kind of stress. When it's prolonged over a period of time, we end up with these kind of situations. So I mean, just to again reiterate the postures, like on the left hand side, as you can see, that's the right way how you need to hold up a phone or a book when you're reading. The right being the absolutely wrong way, like we saw. The reason mainly being this increases the weight of your skull, and it's the same muscle that has to hold it, which was supposed to hold about a 10-12 pound of weight of the human skull, and now it has to lift about 60 pounds of human skull. So that muscle and ligament, that's why it undergoes that inflammation. Then secondly, coming to a work posture, we start off when we are working, we sit in a straight kind of position, and we are usually very correct. And once we tend to get absorbed in our work and we are really concentrating hard, we tend to lose track of time. We tend to lose how we are sitting. All our focus is in the work, and this is what happens. And so again, when you're spending hours together in this kind of postures, you tend to end up having some kind of damage both in your upper back and in your neck, that is the cervical spine as well. last few years threw us a new challenge, the pandemic, and as a result of which we had the work from home kind of situation coming up. Though it's opening up right now, we still have quite a few, with the mixed or the hybrid scenario where a lot of people are spending quite a lot of time at home working on the same kind of devices. So usually they don't have the same ergonomic kind of tables at home. You tend to work from whatever is available nearby, like your sofa or your bed, and this has in fact led to sort of worsening the situation. The same kind of stresses, but they're now much more multiplied as before. So this is just in general talking about the cervical spine, and the treatment modalities are usually when we see these patients, it is usually just muscle relaxants, anti-inflammatory kind of medications. So when a patient comes to us in the initial stage with this kind of pain or stiffness, we do not recommend exercises. Exercises are mainly for prevention. That is something that is very, very important that I would like, if that is even a take home that you could, get to today, I think that would help, because almost each and every of my patient who has a neck sprain or a spasm in the neck, the first thing they try to do is to stretch it and move it around and try and get it free. That is something that you should not be doing. You should not, or if they know about some exercises, physiotherapy exercises of the back or the neck, they try to start doing that, and this would in fact actually worsen the condition. So in an acute scenario, when you have spasm, when you have pain, stiffness of the neck, what you have to do is just rest it out. Let nature do its thing, but do not try and stretch it, because you will worsen the situation. Remember, the exercises are for preventing. So when you're completely normal, that's when you have to be doing the exercises, so that in the future you wouldn't get these situations again. There's this lot of massage kind of treatments being done. So some of them, when you do it at home in a gentle kind of fashion, that's okay. But some of those massages that are done, the so-called professional kind of massages, we have seen a lot of issues cropping up with that as well. So I wouldn't recommend that at all. And always remember, when you have a spasm, when you have that tightness, you cannot move your neck around and your neck is really stiff, always try and do warm water fermentation rather than using ice packs, because an ice pack is going to increase the tightness or the spasm in your muscle more. So always use a warm water fermentation when you have a stiff neck. Okay. And then, so how to correct is, again, making sure that you're sitting up straight. So as you can see on this image, so when you're looking straight, again, you're taking care of your cervical spine, and at the same time, your lower lumbar spine as well. So the best way is to have a chair which has got a bit of a spring action, which can recline about 25 degrees backwards. That's the most ideal position, because again, when you sit straight upright, it's going to put a bit of strain on your lower lumbar spine, and you can have problems there. So this kind of 25-degree of reclining is the right way of working. The best way of doing that, reminding yourself, is to put up some kind of an alarm, and that would keep reminding you every 45 minutes or an hour that you're sitting the right way and you're not sitting straight up. Because what happens over a period of time is, once you start sitting straight, you start tending to stoop forward as well after after some time. So again, the prevention, so just to give you an idea of how to maintain this posture, is when you're sitting up right, you just have to make sure that your ears are at the same level as of your shoulder when you're looking at it from the side. I know it sounds a bit, difficult, or not difficult, means you'll have to check on it repeatedly. It sounds a bit, difficult in between your schedule, but you have to, just like I said, put in those alarms, make sure that you're maintaining that position. And also, other very important thing is frequently change positions. Don't just sit in one position. Get up every 45 minutes, half an hour, and take a small stroll, just come back. And then, of course, again, in prevention, is what's very important is meeting up a physiotherapist, doing these exercises very, very regularly. So the exercises would be, of course, be trained by your physiotherapist, and you just need to see it once, and they're pretty simple. So you can keep doing that at your home itself. Then coming to the lower back issues or the lumbar spine issues, the commonest problems that you have is, again, it's so whenever you talk about lower back, we normally talk of severe issues like slip discs or sciatica, those kind of problems. But majority of them are the small ligament injuries or muscle spasms, which usually trouble you. But these are early warning signs that sort of the body or the nature is telling you that if you don't take or intervene at this stage, you could end up having slip discs and kind of sciatica kind of issues. So again, the common causes of faulty postures, sitting for prolonged hours, extensive, mainly kind of road travel. These are issues that these are situations that increases these problems. The treatment again here is absolute bed rest. When you have lower back pain, the best way to treat it is, even you can just do that at home, is you have to just lie down for about 24 to 48 hours. Just getting up for your basic needs like having food or going to the bathroom. Rest of the time, just lie down, keeping a pillow under both your knees so that your legs are slightly bent, or you could sleep sideways in a fetal kind of position, that is, folding up your hip and knees all the way. So that also releases the pressure on the lower back. A lot of people go in for treatments like traction. There is clear-cut scientific evidence that there is no role of traction in today's world for treating, lower back pain. So all you have to do is bed rest, and that would take care of it. Medications, painkillers, muscle relaxants would help. If they don't, then you have to go and meet a physiotherapist. Again, not for exercises, but you'll meet a physiotherapist for certain modalities, what is called as IFT or TENS, where they give small electrical vibrations to the area of your lower back. They would give ultrasonic kind of vibrations there, and that takes care of this, severe spasm and pain. Again, I'm just repeating that point. Physiotherapy exercises would be started once your pain is completely over, because it is purely for preventing these kind of problems. So coming to the point I discussed before is that of weekend athletes. Very, very important to understand is that there is a difference between what is a sprain and a strain. So this is basically, a sprain is any injury to the ligament, while as a strain is an injury to a muscle. So I wouldn't go into the technicalities of that. So commonly patients coming to us, so like I said, it's a question of overcompensating. The entire week you're, sitting, you're being sedentary, there's not much walking around. And then suddenly towards the weekend, you feel like it's, of course, trying to, sort of compensate for what you have not done throughout the week. And at the same time, you're inspired by certain sporting activities or sporting heroes, and you want to emulate them. And we've seen a lot of patients turn up with joint kind of ligament injuries. So the commonest joints that get affected are the ankle, the knee, and the shoulder. So the ankle, you have, again, normal sprains, strains, and there are certain major ligaments like ATFL ligament. In the knee, you have this ACL ligament, or there is this cushioning structure in between called as a meniscus, which you end up damaging. Again, in the shoulder, you have something called as a rotator cuff injury, which is, again, one of the most important stabilizing muscles of the shoulder. And it usually happens to players who are, throwing the ball, who's a baller or who's doing something like a javelin throw, and you can end up tearing that muscle. And these are situations, like all the ACL, meniscus, ATFL, these are situations where you cannot just treat it normally with, rest and medications. It might need some kind of a surgical intervention. So there are 3 grades of strain. So not every strain or sprain would need surgical treatment. The grade 1 or grade 2 strains, which is minimally or partially kind of damage, can be treated very easily with rest medicines. But as you can see, a complete dissociation, like in a grade 3, would need some kind of intervention. If you don't, if it's a very functional kind of ligament, like your ACL ligament, or a muscle like your biceps muscle, if it's torn completely, unless you get it repaired, it's never going to function again. So but it's pretty rare. If you look at all the injuries, out of that, it's just 2 to 3% are grade 3 injuries. Otherwise, almost 95% of them are just grade 1 to grade 2 injuries, so which can be very well managed with rest. So just again, running through the conditions. In the knee, you have the meniscus and the ACL. the rotator cuff in the shoulder, and in the ankle there is something called as an ATFL, tibiofibular ligament. This is again a very common injury, but usually it's just so what is typically called as an ankle sprain, and it doesn't need a sporting activity as well. It's sometimes you just walking on an uneven surface or with a high heel kind of shoe, and all you need is your foot turn inwards, and you can sort of damage that ligament. But thankfully these are usually just the grade 1 sprains, and they respond very well to conservative kind of treatments, resting it out, using ice packs, elevating it, and few days of anti-inflammatories, and you're good to go then. The time when you would actually decide on meeting a doctor is if this pain doesn't go away at the end of 1 week, or if the swelling is massive around your ankle, or if the pain every time you load your foot down and the pain is quite intense and it's been the same for the next 2-3 days, for at least about half a week or 2-3 days, then there's no doubt about it that you've definitely done a bit more damage than the routine regular kind of a grade 1 sprain. So this is the time where you should not then be waiting on it, because better get a surgeon or a orthopedician to have a look at it. And usually then the treatment is you're given a plaster cast, and then you would have to use a walker so that you're not loading the leg for the next 3 to 4 weeks. So almost a month you would be out of action in terms of standing and walking. So, but that's needed as well in some of the grade 2 injuries. But it's better to get it checked once from the specialist. Fractures, again, fracture is a injury in the bone. So you have something called as a simple fracture or a compound fracture. The simple fractures are ones in which, usually the bone is just broken, but then there is still a kind of connection between both ends of the bone. But well, as a complete displaced compound fracture, there is absolutely no connection between the two ends of the bone. So you would be confused as to a lot of times you go with a fracture to a doctor, and there would be sometimes they would say just put in a plaster and you would be fine. But some of the fractures they would say no, you need surgery. So the compound fracture where there is no end-to-end contact, that is the time when you need a surgical kind of intervention for a fracture. But if your fracture ends of bone, they have good contact with each other, then all you have to do is put in a plaster. But yeah, it's going to take about a good 2 to 3 months for it to heal up completely based on the localization on the type of injury that you had. The treatment for all these, the ligament injuries, sprains, and even the mild kind of fractures are usually ice fomentation, bracing, medications, some injections, and of course, if it is like I mentioned, if it is severe, then you need surgical intervention.
Doctor, sorry to interrupt you.
Yeah.
Just in the interest of time, because if
Sorry,
which is why I'm requesting all doctors to keep the presentation short, because questions are so many and we have very limited time.
Okay. So I'm just I'll just I think conclude with my just last
Sure,
two of
doctor.
these slides.
Thank you. Yeah.
Sure, I'll do that. So again, like I mentioned in the start, the overuse or the repetition injuries are very commonly seen. This is something called as a tenosynovitis, earlier called as a BlackBerry thumb. It was because of repeated typing with your thumb, you tended to develop inflammation on the base of your thumb. And but this is again very easily treatable with just medications, physiotherapy. Very rarely you need surgical kind of treatment, that is to release that compressed part of the tendon. And this is something, again, when you're spending a lot of time in front of a laptop and typing, there's a constant pressure that comes on the base of your wrist, and you can get this nerve that is there just below, which gets inflamed, and then you can develop this neuropathic kind of pain. So the treatment, again, there is mostly just medications, and towards the end, of course, it doesn't respond to any of this. We need surgical intervention there. So prevention is identifying the condition and just having proper padding or support kind of that, and avoiding these kind of repeated movements. So I would like to stop there, and I'm so sorry about overshooting.
Yes, doctor. It's just that, because people have been we don't actually have time for questions, but if you can just answer very succinctly. There have been questions that have come in for, because teachers have long hours of work and they land up standing. Many of them have this bone and knee pain, the arthritis kind of variety, but I'm not getting into those details, some of which you've already addressed. But there is, this question from this teacher called Vandana, and she says that if I want to remain an active teacher, active person, teacher from Pawar Public School, Vandana Angne. I want to remain an active teacher with good health. So broadly speaking, yeah, you did mention the specifics. Any one tip that you would leave for all teachers?
I think, yeah, with the
Without
specific to
injuries.
I think specific to the teacher profession, like you mentioned, standing is the biggest risk factor. And when you're standing and working for long, I think the biggest strain, the area that is strained is your lower spine, the lumbar area. So they have to make sure that they get those breaks every 45 minutes to 1 hour. They're sitting at least down, sitting down for about 15 to 20 minutes before they stand. So that is definitely a proven cause for having lumbar disc problems. You can get varicose kind of situations, that is, venous kind of dilatations in your lower leg if you're standing for long. So these are again very specific conditions, but you should know about them, and these are specific to the profession of teachers. But then to remain active, to continue being healthy, it is the basic kind of like for everybody else, being active, having a good lifestyle, eating healthy. Those are things that are going to take care of it.
Thank you so much, Dr. Sinu Kumar. Thank you for actually
Sure.
taking time out for our teacher community and putting out so much of terms and things that they face in their profession. Thank you once again.
Thank you so much.
I would like to now move on to our next guest, and I would also just, in the interest of time again, I request all our guests to keep in mind the question time, because that is what will make it very effective for teachers. So if you can keep it crisp and concise, I have great pleasure in inviting Dr. Bhushan Joshi. Dr. Bhushan Joshi joins us from MH Kardi. He's a consultant on neurology, and let's hear what he has for all of us. Over to you, Dr. Bhushan.
Hi. Thank you for opportunity, and it's my great pleasure to speak in front of this eminent audience of all teachers who are actually one of the noblest profession amongst all. I'll say most noble profession, and the topic given to me is stress management, understanding stress and stress management. So stress. Let us understand what is stress. Stress is any sudden change in physical, emotional, or psychological environment leading to strain. So what is this environment? The environments we divide into internal and external environment. Internal environment is your health, and external environment is the environment in which we work, we study, we play, we live in. So that is external and internal environment. Stress is not just an emotion. There are anatomical basis. There are structures in our system which control stress. So main structure which controls our stress is in brain. We call that thing center of stress is hippocampus. Hippocampus is an area of a brain which controls all of our emotion, particularly including stress. Forget just not stress, all other emotions. So it's a, in short, or in simple words, we call that reward and punishment center. So whatever we are doing and whatever our emotions are actually generated by this reward and punishment center. Then it controls our different glands. Pituitary is one of them. We are aware of pituitary. Adrenal gland is second gland. These are the two main glands which releases certain hormones which creates appropriate change in our system, leading to feeling of either happiness or sadness or stress. So when anyone is stressed, the main hormone released are corticosteroids, adrenal corticosteroids. We'll not go in detail of that, but whatever those hormones are, they lead in increase in our heart rate, blood pressure, and increase in the speed of circulation of the blood, increase in urine production. So and plus negative emotions like sadness and anxiety. So if what happens if we consistently stimulate this hormone, then that leads to a permanent change in our system, leading to many neurological conditions. So as a simple example, in view of considering time also, I'm just going to discuss one common neurological condition which is associated with this stress. So migraine is this commonest example. Migraine, we must almost everyone must have heard about this condition. Migraine is a condition in which patient gets headache. Headache is the most common example of that migraine symptom. Headache is the most common symptom of migraine, and most common cause or trigger of migraine is stress. So all how this stress affects migraine. Stress, physical stress. If you're fasting can trigger, or those a patient if suffering with migraine and he or she is fasting, that can trigger the migraine. So prolonged fasting, change in timing of the food. So being in a teaching profession, say sometimes you're very busy, food timings cannot be followed. Breakfast, lunch, and dinner, 3 meals are compulsory to minimize our stress. Intermittent fasting and those sort of methods are usually stressful for body. So 3 meals are recommended. If food is missed, that triggers migraine. So physical stress triggers migraine. Sudden sleep deprivation. If your patient or any individual is not able to sleep for more than at least 6 hours at night, if they are sleeping less than 6 hours in night, that lead to increased production of this stressful hormones, adrenocorticosteroid hormones. So this sleep deprivation triggers migraine. Sleep deprivation is also independent risk factor for many cardiovascular condition. Rather, it has been proven if you are sleeping consistently less than 6 hours, it is as bad as smoking 10 cigarettes a day. So sleep deprivation leading to physical stress, leading to these many bad effects on our system. Second, emotional stress, sudden tension. A patient or individual is going to emotional stress, say exam or sudden financial stress or time limit or task given to be fulfilled in particular time. These deadlines, this kind of emotional stress also triggers migraine. It causes increase in blood flow to patient's brain, leading to that typical throbbing type of headache. And along with medication, when I'm trying to treat my patient of migraine, the most important concept is stress management. So I ask my patients to keep their food timings regular. Breakfast, lunch, dinner should be on time, 6 to 7 hours of nighttime sleep, and regular exercises. So if you handle patient stress and give him certain medication, the response and results are long lasting and persistent. If I ignore the stress factor, then uh, only medication may not work completely and patient may not get adequate result. So this is a simple example, as I have selected migraine because it's commonly known. But the point here I want to convey is stress management. If I ignore stress, any neurological condition will not respond to medication alone. So few tips regarding how to manage our stress. So as I said, stress is produced by certain hormones. So happiness is also produced by certain hormones, and reward and punishment center. Punishment part was stress, and reward and happiness part is again situated in the hippocampus. So for stress production, there are only 2 or 3 hormones, but for happiness, there are 4 hormones. These commonest 4 hormones are serotonin, oxytocin, uh, endorphins, and epinephrine. So these 4 hormones, how to generate those hormones? Serotonin is called as the calming hormone. Oxytocin is called as the feel love hormone. Then endorphins are called as energetic hormones. And how to generate these hormones? So let us understand one by one. The last one was dopamine. Dopamine is called as feel good hormone. So we'll start with dopamine, feel good hormone. Dopamine is usually released when you are doing certain activities like which will give you happiness. For example, performing certain hobby, listening to music, watching movie, playing a game of badminton with your friend or in your club, or drawing, painting. So these activities stimulate production of dopamine, which causes feel good or happiness. So by doing this, if you are going through stress, at least take out 20-30 minutes to inculcate any hobby, try and learn new things, and do it meticulously. That joy will help you to control your stress. So second hormone I was talking about, endorphins. Endorphins are released when you are exercising. When you are cardiovascular exercises, particularly when your heart rate crosses 100 and you experience sweating, that is the level of exercise I'm talking about. When we do those type of exercises, our brain releases endorphins. Endorphins give us feeling of strength, feeling of internal internal strongness. Then that prevents us from getting stress, and that prevents us from experiencing the sad emotions associated with any minor illness. So endorphins are also called as happy hormones. How to release them? Just 20 minutes of cardiovascular exercises at least 4 days a week. Now serotonin. Serotonin is the calming hormone. Doing spiritual activities, yoga or meditation, sitting in front of the place of worship and just meditating, staying calm. At least 10 minutes of calmness or meditation has proven to increase the serotonin concentration to almost double than the baseline. So doing all these activities helps us to reproduce this serotonin, and we can experience calmness, and we can manage our stress if you're doing. And the last hormone, happy hormone, I'll talk about is oxytocin. Oxytocin is the loving hormone. Go sit with your friends, laugh, crack a joke, cuddling, hugging your kid or your pet, or socializing. These are the activities where our brain enjoys them by releasing oxytocin. So meeting with your summary is meeting with your friend, enjoying playing a game or inculcating any hobby and enjoying that hobby, exercising, meditating. So you can give at least say 1 hour in your day, whatever busy schedule, and regularly to either of these activities, which will release these happy hormones and which will in long term tackle the bad effect of the stressful hormones, and in turns it will reduce bad effect happening on your system. So that is all on my side. Thank you.
Thank you, Dr. Bhushan. I have a few couple of questions for you. I'll keep them quick in the interest of time.
Yes.
And I'm also clubbing a few questions. It may not necessarily be in your department. Nevertheless, just to put them out, is migraine related to cough and cold or acidity? That's one question. Also, this profession, which, as we mentioned, has long-standing hours. So most teachers say that they suffer from throat pain, which they don't recover from, heel pains and cervical pain, and this kind of a stiff back. So, as a neurologist, how do you address these?
So, yeah, first one question regarding trigger about migraine. I mean, they say that anything under sun, including sun, can trigger migraine. But these triggers are individual specific. So, if you are suffering with recurrent migraines, then you have to note down any particular factor which you did differently on that day. Say, suppose drinking coffee, for example, and if consistently that is the factor or correlation you are observing, then that is the trigger for that individual patient. And
Right.
then I suggest my patient to avoid only that particular thing. If you Google the things which can trigger migraine, as I said, there are plenty, anything can trigger it. So suppose, as in the last example, coffee is triggering migraine for that individual. It may not trigger my migraine. And if say tea is triggering my migraine, it may not trigger your migraine. So you have to identify, and you have to give time, maintain the particular diary, how frequently you are getting, what any particular object you have done differently, thing you have done differently on that day, and that is how you can identify your migraine. Regarding the long-standing pain, pain resulting from speaking loud and standing for long period of time, Dr. Sinu sir addressed that part. But see, I just mentioned about the endorphins. Endorphins, see, if my patient is suffering with a long disease, even after disease is gone, cured, for example, we'll say dengue. Dengue is cured, platelets are normal, fever is gone, but that fatigue persists. So that fatigue is also a result of this chronic illness. Endorphins help us in fighting that illness. And I just discuss about that, how to naturally produce endorphins is 20 minutes of vigorous cardiovascular exercises, at least 3 days a week. If you do that, you will, within 10-15 days, start noticing that these chronic pains, which are not specific because of, say, any particular bony injury, you will get rid of those pains.
I think that's a very helpful tip. Thank you, Dr. Bhushan Joshi. Thanks
Thank you.
for
My
giving
pleasure.
to our teachers. Please keep using the chat box. In fact, one of the questions is for Dr. Sinu Kumar. If you can please put this answer in the chat box also, Dr. Sinu. If at all you're still online and can, or if you're attending to a patient, of course, we understand. But this message for Dr. Sinu Kumar was like, my name is Vanita from Dwarka School, Mahalunge, Chakan. I have a heel pain in one leg since a year. It's very painful. What is the reason of this pain and what is the treatment? That's what she has asked. So please do put it out in the chat box, whatever you wish to answer that. I'd like to request Dr. Asmita Dongre, consultant OBG, gynecology and obstetrics, because there are so many issues that women in particular face and women teachers among them. Let's hear what Dr. Asmita has to say. And then if there's time, we can have questions for her as well. Dr. Asmita.
Okay. Good afternoon, everyone. I'm Dr. Asmita Dongre. I'm consultant obstetrician and gynecologist in Manipal Hospital, Baner, Pune. Today, I'm going to share some information about PCOS or PCOD. It's one of the most common terminologies used nowadays. So PCOS stands for polycystic ovarian syndrome. So it is very common. So 1 in 10 women have PCOS. It is a common condition where hormonal imbalance causes irregular periods, which means ovaries do not release the eggs regularly. Excess of androgens, which may increase the facial hair, and polycystic ovaries seen on sonography, where every ovaries look like they are enlarged and they contains multiple fluid-filled sacs at the outer edge of the ovary. If you have at least 2 of these features, then you may be diagnosed as a case of PCOS, for which you need to get some blood tests done and an ultrasound. Symptoms can vary from woman to woman, and some women might experience mild or fewer symptoms, whereas some may be severely affected. So let us understand what is PCOS. So all of us know that the female reproductive tract consists of uterus, then cervix, vagina, 2 fallopian tubes, and ovaries. These ovaries contain egg bank, which is stored in fluid-filled follicles. So the pituitary gland, which is located at the base of the brain, directly regulates the function of these ovaries. The pituitary gland secretes follicle-stimulating hormone, that is FSH, and luteinizing hormone, that is LH, to regulate the function of ovaries. So each month, when the pituitary releases FSH and LH, it stimulates the ovary to grow follicles and make the follicles mature. So as these eggs are maturing, it secretes estrogen. And the estrogen actually makes the egg bigger. And once it reaches at certain level, the pituitary sends signal for LH to increase, which helps in releasing the egg, mature egg from the follicle. This process is called as ovulation. Now, once the ovulation has happened, this free egg again travels from the ovary to the fallopian tube, and it awaits here for fertilization. So suppose if fertilization does not happen, then this egg gets dissolved and the inner lining of the womb is shed in the menstrual cycle. So if you have PCOS, then your pituitary may be releasing abnormally high LH, as a result of which these follicles are not growing the way they should grow, or the ovulation is not happening at all. So that is the cause of anovulatory periods and infertility. So in PCOS, what happens is that some of the follicles may not dissolve, and they actually are seen in the ultrasound like this, sitting at the outer edge of the ovary like a fluid-filled tiny sacs. That's why it is called as a poly, that is multiple, cyst-like, that is cystic ovary. Actually, there is nothing like a big cyst or something like that. These are the follicles which do not dissolve or may not ovulate at all. Okay, so PCOS is also considered as like related to high level of insulin. All of us know insulin is a hormone which regulates the blood sugar in our body. So what happens is that in PCOS, your body is not responding to the insulin in your own body, and what happens is sugar levels are rising. So the more sugar level is rising, the body is producing more insulin, and this phenomenon is called as insulin resistance. So because of this insulin resistance, it causes weight gain, irregular period, and fertility problem. In addition to this, high insulin levels can lead to androgen excess, by which I mean male hormone. So that causes increased hair growth over face, back, buttocks, or chest. So I know this figure is a bit complex, but here I can show you that pituitary secretes FSH and LH. They stimulate the follicular growth. And once they start growing, estrogen level is rising here. In the middle of the cycle, once the estrogen has reached certain level, the LH surge is happening. And here you can see ovulation has happened. So this axis or this rhythm is disturbed in PCOS. That's why we say PCOS is a condition where it is hormonal imbalance, and the exact cause is not known. These are the biochemical abnormalities or hormonal abnormalities which we can talk about. The why it happens in one person, that reason is not really known. It has seen that it runs in the families. So as we know, like, what is PCOS, let's go and understand that how to manage it. So as I told you that it presents with irregular periods or no periods at all sometimes, difficulty in getting pregnant because irregular ovulation or no ovulation happening at all, excessive hair growth over face, back, buttocks, and chest, weight gain, oily skin, and acne. Also, studies have shown that it is associated with increased risk of type 2 diabetes mellitus and high cholesterol levels in later life. So managing PCOS, it is important that we follow healthy lifestyle. So it is the mainstay of the treatment of PCOS. So we have to aim that our body mass index is between 19 to 25. And to gain that body mass index, normal body mass index, we need to eat healthy, do regular exercises, and follow healthy dietary habits. So losing weight is very important in PCOS. Studies say that even if we lose 5% of the weight, the symptoms can become much, much better. So in choosing diet, it is important that we choose high protein meals and low carbohydrate meals, by which I mean choosing proteins like chicken, fish, egg, and if you're vegetarian, then tofu, soya food you can choose. And low carbohydrate is that cutting down to sugar, then salt, coffee, and choosing like brown bread or whole meal like grains and cereals you can choose. Also having fruits and vegetables, it is important because it has antioxidants which play a role in preventing the free radical damage. So choosing healthy diet is extremely important in treatment of PCOS. Also, medicines are available to treat the symptoms. which includes if someone has irregular periods, you will be offered birth control pills to regularize your periods. If there is problems with excessive hair on face, then anti-androgen medications can be taken to rectify that. Also, as I told you that insulin resistance is one of the factors which causes PCOS. Diabetes medicines are also been prescribed. And the women who are looking for fertility problems, we prescribe fertility medications. We try to regularize the cycle. We give medications so that you ovulate and you conceive a baby. In case if it fails, then there are certain simple procedures, surgical procedures, which includes laparoscopic ovarian drilling, which plays important role in inducing ovulation. So actually, I have kept my presentation very crisp. So my message is educate yourself, like by which I mean that we need to understand our body. We need to understand that we should have normal body mass index. And we all teachers, mothers, and you must be seeing all the girls in the school. So faulty diets is a big thing now. Eating preserved food, a lot of pizza, pasta, all maida things people are eating and not regularly exercising. So educate yourself, by which I mean, whatever you are eating, how much you're exercising, that is very important. Empower yourself, that is motivate yourself to eat healthy and do regular exercises. And definitely then we'll be able to end the PCOS. So I hope that I was able to give you bird's eye view of PCOS. And if you have any questions, please feel free to ask or post in chat box as well. Thank you.
This was so, succinct. At the same time, it was so useful, Dr. Asmita.
Thank you.
Thank you for, it's good that you've kept the, presentation concise, just so that you can interact a little bit more. Please, if you have any more questions for Dr. Asmita, you could certainly place them on the chat box. But one thing which had come up, there were many questions which came in even at the entry stage. We're not able to include all of them because of want of time. But I can see that there are about 500 people participating. So a huge thanks to the teacher community for coming out in such large numbers. So there is, what is the one factor, Dr. Asmita, that while we know the sedentary lifestyle changes, you also said that people are eating, maida and unhealthy, but at the same time, the realities of life for a woman, particularly, let's say in the ages of 20 to 40, that, sometimes you're a working woman, you just don't have the time for self-care. But that's also the most important time of a woman's life. It's a reproductive phase. You're raising a family and children. So given this kind of work challenges and reality of not being able to make the best of things, have you come across good case studies among your patients that were young and who are still able to do things to prevent things like PCOS?
The first and foremost is, you have to control your weight. That is the most important thing. The half of the job is done if your body mass index is normal. And to control that, you have to have healthy choices while you eat. That is the most important thing. All these things, you require medications or fertility treatment, that comes very later. But if you're getting hold of your body mass index, you're downloading apps and checking, then it is quite possible that we will be able to avoid, full-blown PCOS. It is not going to run anywhere. If you have a PCOS, then you have PCOS. It is not going to run anywhere. It's like diabetes. You just have to cope up with PCOS, change your lifestyle, and keep it under control. And that is quite possible.
Weight management, and of course there are things now, let's say like yoga and other forms of fitness people can look for.
And just to add, healthy mind, actually it comes first, it is healthy body and then it is healthy mind. That's what I believe, because it's all biochemical thing. Mind is, so it's all biochemistry. So it is very important that we all are following, our daughters, sisters, everybody should follow healthy diet and exercise. That's a must.
True, doctor. Swasth Man is what houses a Swasth Sharir ultimately. Now we have
Thank
a
you.
question by Shubhada Londe, who says how acne and excessive hair growth can be controlled at the age of 20 in the case of PCOS.
Okay. So for acne, first of all, skin routine is very important. Like, because these girls are in such a age group where they're very active, going out and everything. When it is oily skin, acne is going to happen. So skin routine following, like cleaning your face at least thrice daily, and making sure that, when you eat, avoiding coffee, chocolates, like avoiding sugar, that is another thing. And there are certain medications, like I told, anti-androgens, which can be given and reduce the facial hair, and it can partly help in acne as well. If acne are like, getting infected, or if, there is any pus formation, then you might have to see dermatologist as well.
Doctor, before I invite Dr. Kavita Verma, one last question
Yes, ma'am.
Is that, yes, in what's the age group of, is it only a young woman's issue? Like, there are teachers who are, let's say, on the verge of retirement or this thing. So give us a sense of what about the menopausal women? Do they also face PCOS? What's the kind of cutoff age?
Unlikely. This is mainly, it starts from early teens till the, you can say 45, 48 or something. As women become premenopausal, perimenopausal, it will not affect them much.
Right. So as in the case of the senior teachers who are there, the women teachers or this thing, any also tip for a healthy life from a gynecology and this thing that you would like to leave with?
Like, if senior teachers are there, and so we are thinking about perimenopausal things, so it again, the same thing applies to them. Eating healthy diet, regular exercise in the form of yoga or walking is also fine for them. In addition to that, some meditation, pranayam is important, because again, it's a shutdown of ovary, so a lot of changes happens, mood swings are there, hot flushes are there, and this is the time when women are going through hormonal shift, and kids are in teenage. So actually sometimes there is nobody to listen to them, nobody to vent out. So I believe in that, they should have a common group where they are venting out their feelings. From doctor point of view, regular exercise, meditation, dietary calcium, dietary vitamin D3. If at all diet is not giving enough, then supplement should be taken. And I think that is all.
Thank you so much, Dr. Asmita.
Okay, thank you. Nice meeting you. Thanks.
Same here. I have questions from anonymous attendees, people who are feeling more comfortable to put their identity in secret, but I've also asked questions. We will probably have the Manipal team reaching out to you, Doctor, to actually direct those questions, and they can probably be answered by email. Thank you once again.
My pleasure. Thank you.
Yes. One such question relates to another doctor. This attendee teacher wants to know, how can we heal spondyloarthritis, fibromyalgia? She's been suffering from a range of ailments, starting with cervical spondylosis, and she has given many of these ailments that she's been suffering from the past 15 to 18 years. I'm sure the Manipal team will reach it to the respective doctors. I would now like to invite Dr. Kavita Verma, who will... After we heard so much about PCOS, it was literally like an education. Dr. Kavita, we look forward to hearing from you on the big C. That's something which even today is a dread for mankind when it comes to women and cancer. So I would like to pass the session now over to you, Dr. Kavita.
Yeah, I hope I'm audible.
You
Can
are,
you hear me? Yeah.
Yes.
Thank you so much for having me. It's indeed very humbling to be talking to a group of teachers, who are the backbone of a conscious, enlightened, and civilized society. I have been given the topic of breast cancer. Are you able to see the screen? Are you able to see the screen?
I don't. Yes. But I'm not sure if it is. Can you just change the? I think it's still the old screen that is coming up, Doctor. Can you please? Yeah, maybe a refresh would help at this point of time. Meanwhile, I'd also like to request all the teachers. We are now 500 strong here. Please post your questions for Dr. Kavita Verma. She is addressing one of the most important issues, which is to do with breast cancer. Doctor, would you like to now try sharing again?
Let me try it. Just give me a minute. Is it seen now?
No, not yet, doctor.
Not yet? Okay,
yes.
1 moment.
I would like to use this time, by the time Dr. Kavita Verma
Seen, I guess? No, not yet?
Not yet, doctor. I will let you know the moment I see the screen up, if at all.
Yeah, I'll just try to get some help.
Amrita Mule from Pawar Public School. There is Shubhrata Londe. There is also Anjali Vishal. There is, it's wonderful to hear from all of you from GK Gurukul. There is Vanita Gargote, Nirmala Sundaram, who's asked about how to keep joints healthy. There is Asavari Dharma, who has asked about heel pain because of continuous standing. There are people who have used the chat box to post their various queries. Namrata Chaudhary, also Rupa Gogate, Darshana Puri. It's wonderful to have so many of you. Bhargavi Devaram from Deputy Patil Dhyan Shanti School, Akurdi, Pune. Reena Pilevar from Kothari Convent, Akola, Maharashtra. Kalpana Singh, Priya Gaikwad. Also Pratima Thakur, Latika Kulkarni. And Ganesh Kamble. Thank you for joining us. And you do see the chat box at the bottom. There are, of course, doctors who are here with us. They have posted, they have shared so much. And Dr. Kavita Verma will be joining us soon as it's sorted, the technical issue at her end. Dhruv Rajhans from, Deepali Rajhans from RMD Chinchwad, Pune. So, बहुत स्वागत सभी का जो teachers, जो अध्यापक हैं, अध्यापिकाएं हैं, जो अभी हमसे जुड़े हैं, बहुत ही खुशी हो रही है, because like every speaker has said, it's definitely a special community, and Manipal Hospitals has great delight in designing this, and I, as a host, my name is Vasanthi Hari Prakash. So please put your questions on the chat box. Dr. Kavita, were you able to sort out the issue at your end? In case you, I think Sonal Pandey and Shikha Sharma, those questions are also coming in. We're also going to take a look at Dr. Kavita in case she's ready to present now.
Okay, am I seen?
Yes.
My presentation?
Yes, very clearly seen and heard, okay. Dr. Kavita.
Okay, so I think there's some glitch here, and I'm sorry about that.
No problem.
I will just start talking about the topic.
Please do.
Of breast cancer. I am Dr. Kavita Verma, consultant surgeon at Manipal Hospital, Baner. And well, talking about breast cancer, a very ominous thing to hear about, why are we so concerned about breast cancer? Now, according to the study by Globocon, every 4 minutes a woman is diagnosed with breast cancer. That's alarmingly how high this is moving. About 178 new cases are diagnosed every year, and this we are talking about in India. For some time earlier, it was cervical cancer, which was amongst one of the cancers most common in Indian women, but breast cancer has overtaken that. And the current trends point to a higher proportion occurring at younger women. Now, this is very alarming. And younger women who are, in the reproductive age group, who have a very long life ahead to live, and they suffering from cancer like this is very distressing, emotionally, physically, in all manners. Now, before I go in and start talking about breast cancer, I would like to mention one thing here, that if there is any problem related to the breast that any of the women notice, please do not, conclude that you have breast cancer. Benign breast diseases account for almost 80% of the breast pathology. So not everything that is presenting in the breast is cancer. Benign breast conditions are practically a universal phenomenon amongst all women, and very, very few benign breast diseases have an ability to turn cancerous. So, not everything in the breast is cancer. since today I will be talking about breast cancer, I won't go into the non-cancerous part of the breast diseases. Now, what are the risks and who are the women who are at risk of developing breast cancer? Age. Now, women over the age of 50 are at a higher risk than women who are less than 50. Those who have a family history, those with genetic mutations, those who have a prolonged exposure to the estrogen hormone, as in early menarche and a late menopause. That is, they start having their periods at the age of 10 or 12, and the menopause they do not stop having their cycles till they are, say, about 55 to 56 years of age. Now, any radiation to the chest or the breast that has been received in childhood or in early adolescence, like it happens with case of Hodgkin's lymphoma, where radiation is given to the chest. Now, these women are at high risk of developing breast cancer. Then exposure to certain drugs, especially one drug which was used in the early 60s and 70s for treating miscarriages, DES, that has a high propensity for women developing breast cancer. Now, these factors that I spoke of, it's something which you cannot control, but the risk factors that you can change really, which are in your hands, that is physical activity. Now, if you see in all the talks of all the my colleagues who have spoken before me, we all stress on being physically active. Now, being physically active has shown to reduce the risk of breast cancer. HRT, that is hormone supplements for women who are suffering from menopause, certain oral contraceptive pills. Again, I would like to mention certain oral contraceptive pills do have a high risk of patients on OCPs have a high risk, but as soon as these pills are stopped, the risk does reduce. The reproductive history. Now, women who are nulliparous, who conceive for the first time at a later age, these are the women who are at higher risk of developing breast cancer. Smoking, alcohol, red meat. These are next in line. Now, what are the symptoms of breast cancer? The most common symptom of breast cancer is a painless lump in the breast or in the armpit. There is disfigurement or there is retraction of the nipple, there is dimpling or puckering of the skin that happens. There could be nipple discharge, and most often this nipple discharge is bloody. So what do you do? How do we evaluate somebody who has any of these symptoms? Now, any pathology in the breast, there are three components to assess it or to diagnose it. They are clinical examination, a radiological examination, and a pathological examination in that order. Meaning you go and visit your surgeon when you suspect that there is something wrong in the breast. So that is the part of the clinical examination. Once your surgeon has examined you, then they would suggest an appropriate radiological examination. Now, the components of radiological examination include a breast ultrasound, which is also called as sonomammo. Then there is mammography, and then we have MRI breast. The indications for MRI breast are very, very minimal, so I will not touch upon that. Coming to breast ultrasound. Now, breast ultrasound is the best modality, especially in younger women who have dense breasts. I would like to stress, mammography is not the investigation of choice in younger women. It is breast ultrasound which gives higher information to us in younger women regarding the breast-related problems. It also helps in distinguishing cysts from solid lesions. Cysts means fluid-filled lumps, and solid lesions. Mammography cannot give us this difference between a cyst and a solid lesion. Now, mammography, the sensitivity of this investigation increases with age, and hence this is used as a screening tool in the elderly or in the high-risk population. That is, women who do not have any breast-related problems should start going in for a mammography, which is an annual feature after the age of 50, if they do not fall in the high-risk category. If they are in the higher risk category, then there are other better modalities, or maybe mammography in younger women in a subset only. So once we are done with the radiological, then comes the pathological examination, which is what is actually going to give us the diagnosis. So the components of that would be a needle test or a true cut biopsy, and women who have just a nipple discharge, that is also examined. So at the end of all of this, we have a diagnosis, of whether or not the lesion is cancerous. So once you have been detected that, fine, we have made a diagnosis that this is breast cancer, we next need to stage the breast cancer. So the investigation that we need in staging is called as a PET scan. This is a kind of a CT scan, which is slightly different from the conventional CT. It's called a PET CT that helps to tell us whether the cancer has spread out of the breast, that is, are the lungs, the liver, the brain, whether these are involved or not. So a PET scan is done for that. So once we have the PET scan, then we come to the staging of breast cancer. The stages of breast cancer would be stage 1, 2, 3, and 4. Stage 1 is called as the early breast cancer, when it's a small tumor, usually less than 2 centimeters, which is restricted to the breast. Stage 2 is when they are larger tumors and they involve the nodes. Stage 3 is called as a locally advanced breast cancer. That is, the cancer or the lump involves the part of the skin or the chest wall. This is called a locally advanced breast cancer. And stage 4 would be a metastatic disease, that is a cancer which has spread to the other organs. So once the stage has been, we know the diagnosis, we know the stage, then comes the treatment. Now, treatment for breast cancer, it's not always only a single therapy for breast cancer. Treatment of breast cancer is multimodal. That is, it involves surgery, chemotherapy, hormonal therapy, and radiation therapy, not necessarily in that order. Depending on the stage, it can be surgery first, followed by chemo and radiation, or it could be chemotherapy followed by surgery and radiation. So depending upon the stage and the hormonal status of the tumor, the treatment is decided, but it is never ever a single modality. It is a multimodal treatment. Breast cancer treatment is a multimodal treatment. So to conclude, not all breast related issues are cancerous. 80% of the diseases of the breast are benign. So, if you notice any lump or a discharge, please do not panic. Do not jump to a conclusion that you have cancer. Do visit a surgeon. And in the same breath, I would like to say, do not ignore symptoms. That just because there is no pain, there is a lump and there is no pain, do not ignore it. Right? And early diagnosis of breast cancer is the key to survival. So diagnosing cancer early will definitely improve survival. Breast cancer, if detected early, is curable. So with this, I conclude my talk. I'm sorry for the glitch. If there are any questions, I'll be happy to answer.
Dr. Kavita, what a clear sort of structured understanding you gave of breast cancer. We all think that we hear so much about it, that we know it in some sense, but when you actually put out very clearly the kind of cancers and so many other details, it really was helpful. I would like to thank you. There are a few questions, so I'm going to try and club them in the interest of time. There is Bilkis Dhamnekar, who asks, is there any problem if double breast is there, that is extra fat from underarm? So is that like risk prone? There is also a question by an anonymous attendee teacher who asks, what care should be taken if there's a tendency to create fibroids in the body? There are two more questions after this, Doctor.
See, the first question I would like to mention here, the teacher probably is talking about what we call as an accessory breast. Okay, accessory breast means an extra breast tissue. It could be a full-blown breast with nipple and areola, or it could be a rudimentary breast tissue. Now, the breast develops from what we call as a milk line, which extends from the armpit lower down into the abdomen, and it's only in the center of that milk line that the breasts tend to develop. So you can have this rudimentary breast tissue anywhere along the milk line, and the most common is in the armpit or in the axilla. Now, having an accessory breast or a rudimentary breast or an extra breast does not increase the risk of breast cancer in any way. So this is a benign thing. It really does not require any specific attention unless it's cosmetically disfiguring and you are not prone to cancer because of that. So that answers the first question. The second one regarding fibroids. Well, it's actually a fibroadenoma. When we are talking about the breast, the most common non-cancerous lump in the breast is called as fibroadenoma. Fibroids are usually in the uterus. In the breast, it is a fibroadenoma. Fibroadenomas are common. They can be single, they can be multiple. It's either one breast which is involved, or it could be both the breasts which are involved. Fibroadenomas are definitely benign. They are not known to turn cancerous. The risk of developing cancer in a fibroadenoma is 0.3%.
Okay. Okay.
So before concluding that a lump is fibroadenoma, it needs to be evaluated. That is very important. So you go through that triple assessment.
Yes, I think that's a very important point. One is, of course, मतलब डर लग जाता है जैसे ही कुछ, you feel something which is like a lump, and then you begin to conclude, it plays on your mind. So the point Dr. Kavita is making is to also have it assessed properly by the doctor. Quickly to the next question. She says, before the breast, as well as tightness in the breast, and sometimes that is worrying. If to distinguish between the pain or a thing that probably she feels before her periods and the pain that probably could be cancerous, doctor, if you wish to answer.
Okay. Now, breast pain is called as mastalgia in clinical terms. Now, mastalgia are of two types. One is cyclical and one is non-cyclical. Cyclical is very typically related to the menstrual cycle. This pain tends to start after 14 or 15 days of the cycle. When the progesterone levels in the body increase, there tends to be some kind of a swelling in the breast, and then women can have pain in the breast. Okay, and once they start menstruating, once they have their periods, the progesterone levels dip, and then the breast swelling reduces, the pain reduces. So this pain is cyclical. It comes and it goes. So pain which is waxing and waning is not a cancerous pain.
Right.
And breast cancer in 80 to 90% of the patients is not associated with pain. So it's a painless lump, which is usually a cancer. Pain, very few cases of breast cancer actually are associated with pain.
Doctor, the last two questions. One is Krishma, who wants to know what in January she was diagnosed with cyst in the breast, and it was cured as well, but it continues to pain. She wants to ask about that. There is also Sri Rajendra, who wants to know, this kind of information that can be given to students in schools, because there are young girls, there are even boys, I think, who need to know about this because there are women in the family.
The first question, sorry, could you repeat that? I didn't get that.
So the question.
The breast cyst.
Yes.
Okay. Now, see, breast cyst meaning
the pain she's facing despite the cure.
Okay. Now, see, this pain necessarily need not be cyst. The cyclical pain that I was talking about is not associated with cysts or lumps. It's more of a lumpiness, a feeling of a lump in the breast, but there is no lump in the breast. So, you need to actually evaluate it, get an ultrasound done, because an ultrasound will tell you whether you have a cyst or you do not have a cyst. Now, cyst, again, let me tell you, cysts are generally painless unless they are because of some kind of an injury or infection. So most of the cysts are painless. Pain and cysts, they are two different things. So you need to know whether the pain is because of the cyst or the pain is independent of the cyst. So this needs an evaluation. So you're treated of your cyst, but the pain persists. So probably the pain was not because of the cyst. The pain is something else. Or there is a residual cyst.
Yeah. I know we are running short of time. Still a lot of questions coming in. One of whom says, lesions in arms, and on diagnosis, she got to know it's lipoma, can it turn to cancer later? Also, if you can just quickly touch upon education in schools regarding breast cancer and on this topic.
Okay, well, see, when we are talking about school children, I think many of them are fairly well aware nowadays that breast cancer is an entity, because someone or the other in their family would have probably suffered from breast cancer. So breast cancer, one thing that you need to know is it has to be picked up early. So how do women come to know that, they have breast cancer? So something called as a breast self-examination. Now, this is not very relevant for school children or girls who are, say, 16 or 18. The question of breast self-examination would come in when the breasts are fully developed. So usually after the age of 18, 20, a fully developed breast self-examination in women is very important to pick up anything abnormal in the breast. Either the shape, the skin or some abnormal discharge from the nipple. So breast self-examination is something that girls or women can focus on. And secondly, if you hear or feel that there's something wrong with the breast, don't be, what should I say, afraid of upfront seeking help. Or don't try to say that everything that is happening is probably just a part of the growth or puberty. So anything abnormal, rather than Googling things and talking to friends, talking to family, consult a doctor, consult a surgeon. So you know exactly what is the problem. And if someone in your family is suffering from breast cancer, it's not the end of life. It's a curable disease. No matter what the stage, we can always attempt to cure.
Very clearly put, very well answered. I'd request you to stay back even after your talk, Dr. Kavita, in case there are more questions coming in.
Yes.
I will make sure that, on the chat box, if you could answer them as well.
Yeah,
So Dr. Kavita Verma, we'd like to thank you on behalf of Manipal Hospitals and of course all the teacher community to have answered and given so much clarity on this.
Thank you, my pleasure.
We now move on to Dr. Dhananjay Zuchi, because cardiovascular diseases, CVD, those three alphabets, when they put together, are something which really are so important, given so much of our urban lifestyle is causing it. But I will leave it to the expert to speak about this. Dr. Dhananjay, it's over to you.
Yeah, thank you. Yeah, good evening.
Yes, doctor.
Yes, I will start the presentation. Where do we start it?
I know that there would be a lot of questions regarding heart attack, cardiac arrest, health tips, how to, curb stress. So these are some of the questions that must be ringing in your mind. We have a lot of teachers who deal with this or with their family members. So please use the chat box. You see the Q&A box on the bottom of your screen. You can type in your name, your school name, as well as a question and what you have. Even regarding CPR, Dr. Dhananjay, if you could spend a few minutes, because that is something which students need to be very much trained in. And if you can shed light, it's over to you, Dr. Dhananjay.
Start, but how do I speak then?
If you want, I can.
Yeah.
Just give me 2 minutes, huh,
yeah,
ma'am?
good. Yeah, the same.
Actually, sir is not able to present. Just give me 2 minutes.
Not a problem at all. Meanwhile, we are taking this time to introduce more questions. If our other doctors can please answer via the chat box. Pratibha Vadekar, who says, good afternoon, ma'am. I have a stiff back mostly at night. I can't sleep the whole night. Sometimes I find it difficult to bear the pain. And is there a solution to this? There's one question which will be for Dr. Dhananjay himself, Gayatri Raut from Dhruv Global School, who says, what care should be taken by teachers to ensure that their stress levels don't affect their daily work, by which he means both personal as well as professional, because this is something which a lot of teachers face as part of their work, and it would be great to have answers regarding this. Also, even as Dr. Dhananjay's team tries to rectify, whatever the glitch that they are facing, I'd like to take this opportunity to inform all our learned teacher audience about Manipal Hospital's network, some statistics for you all to think about, which is that the almost 4.5 million patients are treated annually. It's the second largest hospital group in India and in your own region, in Pune, Baner and Karadi, there are, important Manipal hospitals. So please do make, take full opportunity to make use of this facility. There are cath labs, there are CCU beds, cardiologists, ambulances, and then there are patients being treated from around 100 plus countries. In fact, I was invited to anchor a program which had international patients who had found success and who had found a cure for whatever they were suffering from. So even in terms of India, regionally, locally, nationally and internationally, this is a hospital group that is out to create more awareness about health issues. So please do make use of that. You could tell your friends as well. There is Kavita Deshmukh, who says that her age is 32 and for the last 2 years she's been suffering from continuing hands pain in particular directions. Can I get a solution? So Kavita, if you could slightly elaborate, when you say hands, are you talking about the arms? Are you talking about fingers or a forearm, the wrist? And is that like something which we call the repetitive, usage because of, let's say, writing or because of texting? What kind of pain are you talking about? Because I understand, as a journalist, I've seen so many of the teacher community who have had to step up their work during the post-pandemic time, taking digital classes, helping students cope. That has meant extra work hours. So please feel free to tell us, what is it that the health issues that you've been facing? What is it that you observe? Has it become more after the lockdown, or did the lockdown give you some kind of time to put some, exercises for yourself? Looks like Dr. Dhananjay, if you are able to present. There's also Aditya Lalit, who would like to know what are the activities we can follow to be stress-free in day-to-day life. So Shivani Khare, who wants to know, but says that there's a slight audio problem. I hope that is sorted out. Meanwhile, there are, yes, so in terms of, questions, you can put them in the chat box and somebody from the Manipal team will get back to you. Also, the doctor's team, can you please send the PPT to arunchakri@gmail.com. Dr. Dhananjay, if you can please hear me. If your colleague can send your presentation to this email ID, Arun Chakravarti from Manipal Hospitals. The email ID is Arun Chakri, ARUNCHAKRI @gmail.com. arunchakri@gmail.com. The other email ID being arun.chakravarti @manipalhospitals.com. So if you do that, then probably the PPT can be played from his end. You can focus on your talk. The last option being, even without the presentation, just like how Dr. Verma did before you, you can please probably go ahead and tell us and talk about CVD, that's cardiovascular diseases.
Yeah, hello. Yeah, good evening. Yeah, I'm unable to have the presentation. Yeah, so we'll just talk about how can we know our risk. Sorry for the glitch.
No problems.
So how can we know our risk of heart disease, and then how can we prevent it? So so as we know, in the modern world, cardiovascular disease has become quite common, and the incidence is quite high. So there are a number of risk factors that predispose us to the risk of heart disease. Now there are some modifiable and some unmodifiable. Our age. So as our age increases, our risk of having a heart problem increases. But unfortunately, there's nothing that we can do to prevent, to escape from this risk. Males inherently have a greater risk of heart problems as compared to females. However, after menopause, the risk in female also increases of having any heart problem. Race, ethnicity have their own risk, and family history increases our risk of having heart problems. So these problems, which are the age, our sex, race, ethnicity, and family history, these increase our risk of having heart problems. But unfortunately, there is nothing that we can do to decrease the risk that occurs from these problems. So these are basically our non-modifiable factors. But at the same time, if we know that we have these factors within us, then we can definitely be more aware and concentrate on the factors which are modifiable. So the modifiable factors are number one being the cholesterol. So we know that cholesterol, there are two types of cholesterol. LDL cholesterol, it's the bad cholesterol, and HDL is the good cholesterol. Generally, we try to keep the HDL, which is a good cholesterol, above 40 in males. And in females, we try to, the recommended value is above 50. Total cholesterol should be less than 200. This is the number one risk factor. The number two is diabetes. We should keep our blood sugars under control. In case we don't have diabetes, then it's best that we monitor ourselves regularly and prevent ourselves from becoming a diabetes. Diabetes goes through stages as a normal blood sugar levels, then we have pre-diabetes, and then we get into diabetes. So if we are able to catch ourselves early in the earlier phases, we may prevent ourselves from this risk factor. The third being hypertension. So hypertension also tracks from the early childhood days, then through the middle age days, and then into the elder population. The recommended cutoff for blood pressure is 140, which is the above, which is the systolic blood pressure, and 90 mm of mercury for the lower one, which we call as the diastolic blood pressure. Well, if our blood pressure is between 130 to 140 and between 80 to 90, then we should be aware that, okay, yes, we are in the prehypertensive range. And when it crosses above 140 and above 90, so then we consider it as a patient of hypertension, and we advise medicines along with all the other lifestyle modification. So in generally, it's this that the increased cholesterol levels, sugar levels, and blood pressure levels that we need to keep under control. Apart from that, we have obesity. Reducing our weight helps us in general. It has a pleiotropic benefits. It improves our blood pressure control. It improves the blood cholesterol levels, the sugar levels, and also our risk of heart disease. Other dietary habits like, other habits like smoking. Smoking is considered as a major cardiovascular risk factor. So quitting smoke is highly recommended for any heart friendly activity. Regular physical activity for around 30 minutes per day for 5 days a week is what is recommended by the guidelines. Even if we do a more strenuous workout, we can do it for 15 minutes per day for around 3 days a week. That's a more vigorous exercise. Otherwise, routinely a moderate intensity exercise for around 30 minutes per day for 5 days a week is what we generally recommend.
Dr. Dhananjay, may I use this opportunity to ask you questions that have been coming in? Some of them have been anonymous. Some of them have put this out. You have managed to address a few questions yourself. Thank you for that. Teachers deal with a lot of issues, particularly in the new age form of teaching. Like some places, of course, have moved on from online, but at the same time, realistically, you're handling a huge class. There are students, you tend to, it's a challenge not to lose one's temper. Now, all this translates somewhere day after day, there's incremental buildup in the stress. So essentially, even anger management, that is something which is very crucial for teachers, along with the fact that they have to cope with so much of pressure themselves, whether it's in terms of evaluating the answer sheets, and of course, filling up those documents that the school needs them to. So this is, and besides their own family life, what are the tips that you would like to offer, Doctor, whether in terms of anger management or in this balance?
For anger management, and it's more of what we can call as an emotional stability. What we would like to recommend is, number one, to have a very good sleep habit. So if we are able to have a good sleep for around 6 to 8 hours per day, this helps us in reducing, helps us to provide more of emotional stability, and the mental stress factor, which in itself contributes to many disease problems, including all the heart problems, hypertension, diabetes. So that component can be taken care of by a good adequate sleep. Apart from that, there are stress management techniques which are like meditation. Meditation and yoga have been proven scientifically to help in for a good cardiovascular health. Even regular physical activity reduces is shown to have an effect on a good mental health.
Doctor, I would like to next ask you about CPR, because there are countries where this is so much part of the curriculum, the fact that you can be, as a common person, equipped to save a life. Would you like to shed light on CPR itself, what teachers can keep in mind, and how this can be part of school's curriculum?
Yeah, it's a very good thing to be to have CPR as a school curriculum, because CPR basically addresses the time gap that is required between the problem that has occurred in a patient and the time till a healthcare provider approaches him.
So sorry, doctor, can you, for those who don't know what CPR is, can you just also explain in quick words? Thank you.
CPR is, the full form is cardiopulmonary resuscitation. So whenever anybody is in a collapsed state, it indirectly means that his circulation, C is for circulation, means the blood flowing within the body. Pulmonary is the lungs, which is the air flowing out from a body into the lungs. So basically, these are the two vital systems that maintain life. The air going in and out, and the blood going throughout the body. So we consider them that when a person is collapsed, so these systems have been stopped. So CPR basically means that we artificially start these systems by our manual efforts, by manual chest compressions, and by giving some air into the patient's oral cavity. So CPR basically is cardiopulmonary resuscitation. We start giving chest compressions with our hands. We give it at a rate of around 100 to 120 times per minute. So this helps in maintaining circulation throughout the body, which is normally the function of our heart. And for the pulmonary, we start blowing air in the mouth of the patient, and this is done at a ratio of around 3:1. So after every 3 compressions, we once blow air into the mouth. This actually will take care of the function, which is the lungs, which our lungs normally do.
I would request our teacher colleagues, friends, to also look up CPR. There are lots of videos on YouTube, because this is such an important aspect. But Dr. Dhananjay has certainly give us a segue and an introduction into that. Doctor, some more questions coming in. I'd like to club them. This comes from Preeti Singh from Pawar Public School. She says, I'm very much fit and fine physically and mentally. Can you please suggest how often we have to go for regular checkup? By which I think she means that it's not something which is so alarming. Then should you still have a regular checkup, and how often?
So in generally, if there is nothing significant within the family, and we are not having any habit like smoking, which sometimes increases our risk, up till 40 years of age, we do not recommend a routine checkup. So after 40 years, so this is for the West, the data is for the Western country. For our population, we may consider it a decade earlier, say around from 30 years.
Right.
So for us, we recommend it after 30.
Right. Thank you, Doctor. So Vibha Dave from Cambridge International School, Pune, how can LDL be reduced effectively without medications?
It can be done by reducing the oil intake in our diet. The oils which we recommend is the olive oil, and all the other oil except palm oil and coconut oil. Remaining all the other oils is fine. And apart from that, even a regular exercise will lower the cholesterol levels.
Vibha Dave again, who wants to know, can you help me distinguish between gastric pain in the chest and any abnormality? I mean, it's a wonderful question that she's asked, because a lot of times, doctor, people either tend to mistake gastric pain for chest pain or ignore a real chest pain thinking it could be gastric pain. How do you distinguish?
So cardiac pain usually is related to our exertional activity. So when we physically exert ourselves, we are walking or we are running, at that time if a pain occurs, then it's more likely to be a cardiac pain. Gastric pain, on the other hand, will occur when we are seated while at rest. And if we lie down, maybe the reflux, it increases. So from going from a standing or sitting to a supine posture, the chances of the pain increases, pain having increases if it's a gastric pain. And definitely a relation with exertion is a cardiac pain.
That's helpful, doctor. Sonali Ghatpande, who says we get advised frequently to change oil. I think she means she has put on doctors, but sometimes even these ads. So this is a healthy heart oil. You get so many things in the media. How she wants to know, Sonali ji, about how to go about this. Like, how do you suddenly shift from one oil to another? How do you know that this is the right oil? For example, I have personally heard about rice bran oil, doctor. Is it really as good as people think? Some people say it is. And what her question has been?
The oils that we discourage to have are is palm oil and coconut oil. But remaining from these oils, the other oils are in general not discouraged. So the extra virgin olive oil is one of the most recommended oils. And apart from that, safflower oil, so soybean oil, mustard oil, all these oils can be used. The thing that is recommended is that we can rotate. Either we can use one oil for 1 week and then shift to another oil for the next week, or even mixing of oils is advised.
Doctor, the early symptoms is what Meenal Kapoor would like to know. Early symptom of any cardiovascular disease.
Early symptoms. So if we have a regular exercise in our daily routine, so it's quite easy to pick it up early. So for example, when the problem occurs in our heart, when the blockages start occurring, which is the most common problem, so it will generally manifest only after a prolonged physical exertion. So if we have in a routine, in a daily routine, say a walk like around 3 to 4 kilometers, so at the end of 3 kilometers, we will start experiencing that problem, and then it slowly progresses. So if we have a good exercise in our schedule, we can pick up heart problems early.
Doctor, 2 more questions. I know we are almost nearing end of time, but Jyoti Kale, who says problem of low BP among teachers seems to be very common. Is there any connection between long hours of talking and low BP, and how do you address this?
Low BP, as such, BP, if it's low, we consider it to be significant only if it's causing any problem. Okay. Problem in the mean if it's affecting the circulation in all our body. So it can either manifest if you are having low BP, at the same time if you are having confusion, or if our hands are cold, our feet are cold, or we are feeling dizzy. So then that low BP is significant. Otherwise, some people inherently have low BP that is more of related to our body mass index. So if our BMI, body mass index, or if our body surface area is less than the average population, then it's quite probable that we can have a low blood pressure, which is not significant. Blood pressure coming less than 90/60 is called as low blood pressure. Anything above 90, the lower upper one is not a low blood pressure, and anything above 60 for the lower one is also not a low blood pressure.
And you don't really see any connection between long hours of talking, as Jyoti ji thinks, and low BP.
That can, if the long hours of talking has been associated with dehydration, if we have been dehydrated during that entire period, then it can lead to low BP.
How much ghee can be consumed in a day, and which one, cow or buffalo, is better? Because you mentioned oils, Doctor. So Jyoti Joshi, this teacher wants to know.
Ghee in general is less recommended as compared to oils. And yeah, but on an occasion, once or twice a week, it's good to mix it with oil. The cow ghee would be better rather than the buffalo ghee.
Cow ghee would be better than buffalo ghee. All right, that helps. I know Pratibha Vadekar, you've had a question regarding a stiff back at night. I can't sleep the whole night. She said, I don't know if Dr. Dhananjay can particularly address that, but we would really like the Manipal team to post it to Dr. Sinu, and then get the response across to this teacher. But meanwhile, I would like to anyway, any final tips, doctor, whether it's regarding, sometimes there are people who say that, it started with a backache and then they realize it's much more than that. So any closing comments on this, Dr. Dhananjay?
Backache is not a very specific symptom of the heart, but it can be one of the less common presentations of a heart problem. So the thing that can give us a clue for backache is that if there is a relation with exertion, as we have already pointed out. So if anything that is related to exertion should raise our suspicion of heart problems. And then if we have other associated...
Can you explain that, doctor? Exertion, that if in simple terms, what should she look out for?
When she is physically exerting herself, if she is started walking and if she is doing a brisk walk or jogging, if at that time her back pain is increasing in intensity, and when she stops doing this, if the back pain gets relieved, then it can be considered that we should rule out a heart problem.
Right. I hope, Ms. Pratibha, that you got your answers. Dr. Dhananjay, despite not having your presentation place, it turned out to be such an engaging session where you gave us so many answers that will definitely help our teacher community. I would like to thank you for your time and for your guidance.
Thank you.
Well, we are come to the absolute end of this show. However, we have Mr. Lakshmanan here. He is the medical director of Manipal hospitals in that region. So it's wonderful to have you, Mr. Lakshmanan. Please, it's over to you and your words for all of us.
Good evening, Vasanthi. And first of all, I would like to thank Sagodaya school members and its office bearers for giving us this opportunity. And also, I would like to thank the consultants both from Baner and Karadi, in disseminating the information, the core health problems that is being faced by the teachers community as such. And we would like to thank, and that is a standard phrase like, prevention is better than cure. So Manipal as such has a lot of wellness programs, especially the health check programs, especially well-women health check programs which we have. So as well as, due to some unavoidable circumstances, if there is any emergency that is happening for the members of the, Sagodaya school members or their family members. So we want to engage both in the prevention aspect as well as, in case of any exigency, through a privilege, membership card kind of an arrangement. Regarding that, we will discuss with Dr. Anjali and the office bearers of Sagodaya School. And we are very happy to associate in this regard with Sagodaya school members. And that's all from my end, Vasanthi.
Thank you so much for putting that out. And indeed, people should avail of this facility, and the teacher community is listening. They have joined us in large numbers today. So thank you, Mr. Lakshmanan, for that note. It's now time for me to invite Nirmal Madam to propose a vote of thanks.
Namaste, everybody. From the Sahodaya School Complex, Pune, I would like to thank the Manipal Hospital authorities for organizing today's webinar. This webinar is coordinated by Dr. Arun from Manipal Hospital under the guidance of their director, Dr. Viju Rajan. I would also like to thank the panelists, Dr. Dhananjay, Dr. Sinu, Dr. Asmi, Dr. Kavita, Dr. Bhushan Joshi for sharing their knowledge and thinking about the teaching fraternity as important citizens. And thank you, Vasanti ma'am, for being the host and being the compare for today. I'm sure that today's webinar has helped many teachers and principals and has answered some of our doubts. In future, Manipal Hospital authorities are planning to organize such webinars for students, and God bless the participants and the organizer. And may I request the director, Dr. G, to please answer all the questions in the chat box and send it to us over a mail so that we can pass it on to all the teaching fraternity in Pune. And about the card, what you've spoken, we'll speak in details and might be in one of the meetings we can pass the cards to all of them. Thank you very much. Namaste. Have a good evening.
Thank you, Madam Nirmal. As she said, there are still questions coming in the chat box. I'm seeing people who are putting in, saying that I'm having a high BP. It's kind of 165, 400. I'm taking regular medicine, but still, what do you do? What should I do? And again, heartbeat rate be related to genetics. And then my mother's heart rate is always less than 72. So all these questions are telling us something. There are doctors who are still online. There are some doctors who have had to drop off because they have had patients to attend. But it just says that the teacher, teachers who have joined us are just as vulnerable as any other group. And I'm really glad that Manipal Hospitals is doing the special targeted awareness program, because teachers are so special. You are very special to us. So like Vandana Angne has said that all the speakers were really very good. It was such an informative session. And then there are people who are continuing to speak about their neck pain, their migraine, their heart stress diseases, their fears and concerns. And therefore, as Madam Nirmal was saying, please continue to post your questions here. And the Manipal team, I think, is also, I would like to place on record a special thanks to Anjali Madam and Nirmal Ma'am for their unconditional support. Dr. Arun is letting me know. It's been a pleasure for me, Vasanti Hari Prakash, to be with you all, to understand what is it that is of prime concern to this very, very special group of people. So, sabko dhanyavad, sabko namaskar. It's time for all of us to part here, but there is social media, there are other things. And as I always say, good people should stay together and connected. Let's build an empowered India. Let's all do very good things. Let this be the beginning of more achhe kaam to happen. On that note, thank you once again. Namaskar.
Thank you very much.
Once again, Vasanti. Once again, be there. Once again. Sure, Vasanti. Yeah, thanks.
The questions are continuing to come, Arun and Anjali. I'm seeing them in the chat box. Yes, it's great, and I think people can see each other's names. And these days, it's so easy to stay in touch via whatever social media that you plan to choose. There are also the doctors here who have taken time off. Until we meet next time in another program, absolutely look forward. Namaskar once again.